Okay, so it's what, April 25th, something like that. 2017. We have a great patient from
Illinois.
Illinois,
Chicago
right,
area.
right, right, Chicago area, my old medical school, Rush, stomping grounds. Uh, a couple of years ago, you had a posterior vitreous detachment and then a big blur grease spot that went across your field of vision, correct?
Yes, in my left eye.
Okay. And you've got other stuff in there as well. The vitreous is never 100% clear. Even when you're young, you can see a little amoeba. But you had a definite, significant blur. What was the problem with that? You couldn't, was it driving?
Well,
reading?
it was just every day. Because the blur was so large, they couldn't correct any vision problems with glasses.
Yeah, well, it wouldn't correct that, certainly.
No, well, even with having correction for that, you're
And,
always...
and there it is. It's the big blur in your case was actually, I felt, behind the natural lens of the eye, and those are more difficult to get than most. And laser can dissipate a lot of that stuff. There's always something to see, but it's better than it was. That's what counts.
Oh, yeah, it's tremendously better than
Yeah.
this.
Did they offer vitrectomy at all?
No. We didn't even discuss that with anybody else.
Well, right now we've done what, 3 laser sessions? Was
Yeah,
it?
it's third today.
So where do you think you are with it?
Well, most of the time they say 100%. I'll say 1,000% better than what I was before, because the clear vision in the left eye now has allowed me to do things just like picking up a set of binoculars before. You almost had to close one eye and just look with the dominant eye so that you could see things.
Very good.
Reading a book is fantastic now. Before I would have to take and adjust my head every once in a while to get that cloud to clear to see see everything clear. And last night I was reading a book for hours without having to move my head.
Well, I think it's going to take a long time before ophthalmologists realize that there is something relatively easy for me, maybe not so easy for them to do. You have to have the right equipment and the right knowledge of what works and what doesn't work. I've been doing this for a long time. And yeah, I'm glad you came down. It's always great to have a success. And
I'm taking a lot of cards. Plus, there's a gentleman that lives down here in Florida that's a friend of mine. His wife has been looking into it, but wouldn't let him come to visit you because she's skeptical of
skeptical?
things. Yeah. So this is going to put him in your office. I know that.
There's no reason to be skeptical. It either works or doesn't work, and I've done more than anybody. You're at the end point for laser for floaters. And we're going to take a look at the right eye, see if there's anything we can do. But I always tell patients more is not better in this game. You reach a point where if you get a significant improvement, and you seem to have that, that's enough. That's enough.
I'm happy.
Great.